Nichols, and I work in EPA also, and I mostly work on Homeland Security.
So nice to have such a diverse crowd. That's very good. Students and yeah, FDA, USDA, the Hill, retired. I know we have Bangladesh, and so thank you and thank you for taking the time to be here after a long day. So you
go ahead.
Okay.
Yeah.
So
Ready when you are.
I'm ready to start. So again, thank you very much for inviting me. Thank you to Will. Thank you, Blair, for organizing this. I tend to walk a lot, so I hope I don't drive you crazy about that. I will be talking today about harmful algal blooms and the One Health approach. And I hope that at the end of this presentation, you agree with me that harmful algal blooms are a One Health problem, and a One Health approach is needed to address it. So let's start. So today, okay, so I'm going to provide an overview of harmful algal blooms, the occurrence in the United States, what are the causes, or what are the factors that help in the occurrence of harmful algal blooms. Then I'm going to go over the health effects, human, animal, and environmental adverse effects. And lastly, I'm going to discuss what are the different activities that EPA is doing to address the issue of harmful algal blooms in the U.S. The review of the Environmental Protection Agency's freshwater systems. So I will be focusing on freshwater and harmful algal blooms, although I'll discuss a little bit on the coastal side and the marine side. But again, our focus is freshwater harmful algal blooms. Next. So algae is essential. Algae is necessary in our ecosystems. Marine algae or microalgae, phytoplankton, it's necessary for the food webs. There are two types, there are the dinoflagellates and the diatoms. In freshwater systems, it's cyanobacteria, the ones that have that problem, harmful algal blooms. Cyanobacteria is not an algae, it's a bacteria, but it has some characteristic of plants. So that's why it's called cyanobacteria, or it was called blue-green algae. So when the microalgae or the phytoplankton, there are certain conditions that make them grow, and when they grow, they form the bloom. So those are known as harmful algal blooms. In addition to that, there are some species that are able to produce toxins. So just because a bloom is non-toxic, so it doesn't have any toxicity, it doesn't mean that it's not a harmful algal bloom. It still could have some effects on water quality, etc. We will talk about that. So we have harmful algal blooms and we have toxic harmful algal blooms. But for the purpose of this presentation, when I say harmful algal blooms, it means toxic and non-toxic harmful algal blooms. As I mentioned, in freshwater systems, cyanobacteria are the most common harmful algal blooms. Some species are able to produce toxins, and these are known as cyanotoxins. I'm going to mention some of them by name, and you will hear about them, and you have heard about them, I'm pretty sure, affecting the Great Lakes. Next. So what causes harmful algal bloom? And this is a diagram that was published by Dr. Hans Perl in 2011 that express or just, it's a diagram that includes both the man-made and also the natural causes or effects that can help harmful algal blooms to proliferate. So natural factors such as water temperature, nutrients, light availability, and water movement are the most important factors for the occurrence of harmful algal blooms. So high concentrations of nutrients, both nitrogen and phosphorus, make the algae or microalgae, phytoplankton, cyanobacteria grow. Water temperatures, an increase in temperature and water temperatures, increase the occurrence of blooms. More light availability, that's why the blooms are more common during the summer season. And also the stagnant waters, they don't, or they allow the algal blooms to form and stay. So water that is moving constantly, like rivers, they don't tend to have harmful algal blooms such as when you compare to lakes, for example. But again, nutrients is basically, nutrients and temperature in the water are the natural factors that increase the occurrence of harmful algal blooms. Changes in the climate are also increasing the occurrence of harmful algal blooms. So the increase of water temperatures are making harmful algal blooms to be more frequent and to have a longer duration. And also man-made effects. For example, the overuse of irrigation water can make salination or salt to get into the freshwater systems. Which can make the species of phytoplankton to switch from the natural algae plant or the plants or water plants to phytoplankton or the species that can produce toxins. So man-made and human and man-made and natural factors can cause the bloom occurrence. And they are all expressed in the diagram very easy. Next slide. Okay, so in this slide, I'm showing you what are the most common cyanotoxins and algal toxins in the marine waters and in the fresh waters. So saxitoxin, domoic acid, brevetoxin, brown tide, acodic acid, and Ciguatera are the most common marine toxins. They are caused against, or they are produced by dinoflagellates and domoic diatoms. I'm sorry, and you can see with the arrows the different conditions or illness that when you are exposed to these toxins, they can cause. So we have paralytic shellfish poisoning that is caused by saxitoxin and is released by a dinoflagellate. Amnesic shellfish poison, neurotoxic shellfish poisoning, diuretic shellfish poisoning, and someone that was very common in Puerto Rico when I was a child was a Ciguatera fish poisoning in our rivers. So the effects of marine toxins depends on the type of organisms and toxin that is released. So you can have amnesia, you can have effects on your neural system, you can have paralysis, death, and diarrhea. I was going to say something on the marine side. Okay, so on the freshwater side, we have the cyanotoxins, as I mentioned, they're caused by cyanobacteria. The most common are microcystin, cylindrospermopsin, anatoxin A. We have limbia toxins that are not as toxins, and saxitoxins. And as you can see, saxitoxin is also produced mostly on marine systems, where they're produced by Alexandrium. Saxitoxins are produced by cyanobacteria as well in freshwater systems. Not as common as in marine systems, but we have found them here in the US. Microcystin is the most common freshwater cyanotoxin in freshwater systems, not only in the US, but worldwide, and is the one that is more studied. And these toxins, anatoxin A is a neurotoxin, so it will affect your neural system. Cylindrospermopsin affects your kidney. Microcystin is a hepatotoxin, so affects your liver. Saxitoxins is a neurotoxin, just like anatoxin, so it causes paralytic shellfish poisoning. And limbia toxin is a dermatotoxin, so it causes rashes and other skin lesions. I forgot what I was going to say about okay, it will come back to me. Next slide. So here I'm trying to show you, this is a slide that I got from my other staff working on harmful algal blooms for many years at NOAA. And it represents the different major events from marine and also freshwater harmful algal blooms in the US. It is represented since 2008. So as you can see, we have DSP, or diuretic shellfish poisoning. That's what I was going to say. Okay, so the marine toxin tends to accumulate in shellfish and mollusks. And so what they do is that when people eat the shellfish, then they get infected. That was important. And then you have the ASP and DSP, etc. So in 2008, we observed a big event of DSP in Texas that moved all the way to, you can continue going, all the way to Florida. We have the brown tide, one in 2012, 2013, 2016. And then in 2014, so as you can see, most of the blooms that were reported in the US were coastal marines, either created by Sylvanesia, the Carenia brevis in Florida. You know, I don't know if you have heard about the red tide in Florida that causes a lot of respiratory problems. Shellfish poisonings, a lot of closures in the Puget Sound, We had DSP and ASP, terrible pseudonecia, closing the harvesting of shellfish in Oregon all the way to California in 2015. And as I mentioned, 2010, that was DSP, a diuretic okadite acid in New York. And so it wasn't until 2014 that we started seeing big blooms in freshwater systems in the US. And that happened in the Great Lakes, Western Lake area, and that affected the intake of the Toledo city, water plant. Then in 2015, we have the biggest bloom we have seen at the Great Lakes, again in Western Lake area. And then in 2016, we reported a big bloom in the Ohio River. I'm sorry, that was 2015 as well. But then in 2016, we have the Utah Lake that it was covered with a huge bloom in 2016. And then in 2016 also, we have a big cyanobacteria bloom in Lake Okeechobee. And then that one moved all the way to the coastal waters in Florida. And we have microsystem both in the freshwater system and in the marine water system. So as you can see, every year we're seeing more blooms, especially freshwater, and then we are seeing that they are lasting longer. And to emphasize on the cyanobacteria blooms, I'm going to talk a little bit about or highlighting two CyanoHABs events that I just mentioned. So the 2014 Toledo event made news at CNN, etc. There was a big bloom, a cyanobacteria bloom in the Western Lake area. It was visualized. It was using remote sensing. That's a picture using satellites from NOAA. As you can see, the bloom is right there in the Western Lake area. So it was visualized that it was moving all the way to the Toledo intake that, I don't know if you can see it from there, but it's right here. And the first weekend of August, I will never forget, August 2, 3, and 4, detections of cyanotoxins, microsystems, were higher than the Ohio value of 1 micrograms per liter. And they were detected in finished water. So the city of Toledo determined to issue do not drink, do not boil. And so 500,000 people living in the city of Toledo was without drinking water for the entire weekend. That required the National Guard to bring an additional supply of water for the entire city, and it created a big public health situation in the area. Then in 2015, we were notified that there was a bloom starting in the Ohio River, which is kind of odd because we don't have harmful algal blooms in rivers as often as we have them in lakes and in the coastal. And then that bloom extended all the way, crossing 5 states and affecting 5 states and lasting 3 months. And making many states issuing health advisories and recreational advisories during that time. Although the Ohio River, there are some areas that are used for drinking water. The drinking water was not affected, but the recreational waters were, and it lasted for 3 months. So, and affected many states. So we have seen that the occurrence and frequency of harmful algal blooms in freshwater system is increasing. Not only the amount of events, but the extent and the length of the harmful algal blooms. As I mentioned, they can affect people, animals, they can affect the water quality, and they can affect the economy. And I'm going to go over those different factors in a minute. And we know that it requires an interdisciplinary collaboration. We need people who understand the dynamics of the ecology of the water, who can understand the factors of why these blooms are forming. Cyanobacteria has been with us for billions of years, and they're very smart, and they know how to adapt to different situations. We need to know what are the factors that are really making these species adapt so well. And just by having a bloom, as I mentioned at the beginning, doesn't mean that you have toxins. We still don't know when the toxins are going to be released. So you may have a Microcystis aeruginosa bloom, which is the main species that produce microcystin, with no microcystin. And then the next day you sample and you have very high concentration of microcystin. 2 hours later, no toxins. So it's very relative. It's we don't understand those dynamics yet. So we need ecologists, we need taxonomists, we need to understand the environmental conditions, the human health effects, and the animal effects as well. So let's start with the human health effects. So people can be exposed to HABs by different ways. So you can consume food or drink water that is contaminated with toxins. So crops that have been irrigated with water that has blooms or toxins may have toxic concentrations. We know from the very little studies that have been done that the concentrations are very low. And I think I'm going to talk about that a little later. The drinking water, as I mentioned, that's a sample from the Toledo intake during 2014 Hamburger Boom event. Swimming, and I would like to say that it's accidental ingestion of water during recreational activities. That people, you may think they don't, but and common sense will work that way, but they see a bloom and they go and swim. And they see a big water stinky scum and they let their dog swim there. So, you see, kayaking. So you can do swimming or doing recreating in water with a bloom. You can inhale aerolized toxins. The toxins do not vaporize, but they can be aerolized in droplets. As I mentioned, Carenia brevis is a type of marine bloom that causes respiratory effects. And people that work in beaches like, you know, the lifeguards or people that are kayaking, that you are having all that splash, they could be exposed to that toxins in the aerolized or the droplets of water. And during dialysis with toxin contaminated waters, and that's the only event that have caused death. This happened in 1997 in Brazil. There was a dialysis clinic. Unfortunately, the tank that provided the water to the dialysis clinic was contaminated with high concentrations of microcystin. So the dialyte that people were receiving were full of microcystin. So they were not only exposed to intravenous contamination, these are people that already have liver problems. So you have a hepatotoxin in the water that they were getting their dialysis. More than 100 people were affected and most of them died. And so that's the only case of death that we have related to a cyanobloom and cyanotoxins. The health outcomes, as I mentioned at the beginning, they differ by the concentration and they differ by the toxin, the type and duration of exposure. During recreational activities and short-term exposures, that the ingestion of water is the risk of ingesting water is low. So we see eyes, ears, and throat infection, kind of an allergic reaction, rashes. It's more of a mild allergic reaction. What we know from toxicity studies is from drinking water, the health effect is damage to the liver and damage to the kidney, as well as neurological damages, and that's from drinking water. And as I mentioned, death is very rare, but in some cases they have been documented. HABs can also affect animals. Animals are affected either by drinking the water with, again, the cyanotoxins, or by eating the algal biomass. We don't know why, but dogs love to eat the scum. Maybe sweet, maybe, I don't know. They love it, they eat it. There's a usually rapid onset of symptoms. In freshwater system, what we're seeing is the death on fish or fish kills. In marine systems, we have seen manatees death, dolphins, sea lions, and sea otters. And there's this story about sea otters in 2007. In Monterey Bay, in California, they found 11 sea otters dead in the Monterey Bay. And so they took it and they did the studies and they found microcystin in the liver. They found the sea otters have, like, the mouth was yellow and the liver was completely damaged. They found microcystin and they said, why microcystin affected the sea otters if microcystin is a freshwater cyanotoxin? And so CDC, USGS, Fish and Wildlife, and I think 2 California health departments, they got all together and said, okay, let's discover this mystery. And they started doing water testing, and they found that in Pinto Lake, which is a freshwater system to the north, they have a big bloom with microcystin that lake drained all the way into a creek. The creek drained into a river, Parajo River, and then that river drained into the Monterey Bay. So the toxins moved from a freshwater system all the way to the Monterey Bay. They accumulated in shellfish. The sea otter ate the shellfish, boom. So it requires epidemiologists, chemists, biologists to get together, do the investigation, and find out what was the cause of the deaths of sea otters. And a friend of mine sent me a few years ago the death of crocodiles in Florida in the Everglades. It was a mystery as well, and it was related to algal blooms. And I was like, okay, another one for the list. So here is an example of dogs, because dogs is a big issue with harmful algal blooms. And every time I go and I give this talk, and I have been into the veterinary conference a few years ago, and I always say it, people love dogs like family, you know? And I don't know why they let them swim in that water. Dogs are exposed by drinking water. They can, again, they lick their paws, they eat the scum. The death is usually very fast if it is anatoxin, which is a neurotoxin. We have seen dogs, or we have reported dogs that died just 11 minutes after exposure. The available information is not well characterized because people do not report the death to the health center or health department, or they don't follow up on the cause of death. So we don't have that consistent reporting of the evaluation of the effects. What we know is that in 2013, Lori Becker from the CDC published a report on the deaths of animals from 1920 to 2012. She found around 300 and something deaths related to harmful algal blooms since 1920. But going more recent, to 2000 to 2012, there were 115 HAB-related events. 89% of those events finalized right in the death of the dog. 58% of those deaths were related to anatoxin A. Again, anatoxin A is a very, very nasty toxin, and 26% to microcystin. Preventable deaths, by the way. And HABs can also affect the water quality. They can contaminate spray irrigation, and this is when I was going to go to the plants and crop information. They can damage the crops. So by diffusion, right, the water can get into the roots and it gets into the plants. And several studies have found levels of cyanotoxins, specifically microcystin, in the crops, in rice, in spinach, and in the leaves. The levels are very, very, very low. So we have not been able to quantify the effect, but we understand that the risk is way lower than if you are exposed in drinking water or dialysis, for example. And also the toxin tends to damage the plants. So we understand that people tend not to eat a leaf that is brown, that it smells bad, that is deteriorating, the same thing with the rice, etc. So we have not quantified the risk, but we understand that the risk is lower. Anyway, yeah, in either case, the toxins can be present. The toxins can also affect the water quality. As I said, the bloom tends to grow, so there's a big mass in the water that reduces the oxygen, causing hypoxia, which is the limitation of dissolved water, and no oxygen, fish cannot live, so it could cause fish kills. It could alter the food web dynamics, as I mentioned, from the microphyte or having just water plants to having the phytoplankton of the microalgae, which is the one that produces the toxins. So it can switch that dynamic of the type of plants that you want in your water system. And the toxin itself could cause fish kills. The cyanotoxins in the freshwater system, and this is something that I'm working on right now, they tend to accumulate in the liver of the fish and not or less in the muscle or the edible part of the fish. So that's a good sign, but some people tend to eat the entire fish, so that is a risk if you're eating the fish or other organs of the fish. We have not seen, or still there is a debate on biomagnification in fish, and we have not seen that is occurring, which is a good thing. In the marine side, as you have seen, we have PSP. They tend to accumulate in high concentrations in fish, shellfish, mussels and crabs. And so it's a big issue having these dinoflagellates or diatoms producing this fish in the coastal side for the shellfish and marine life. It could also cause economic impacts. So again, affect drinking water system. So you have a bloom. The traditional drinking water system treatment is effective in removing cyanobacteria cells. That's a good thing. However, some toxins like microsystems tend to keep their toxins within the cell. So if you remove the cell, you have no problem. Okay. Cylindrospermopsin releases the toxin half the time. So even though the cell is complete and intact, they're still releasing the toxins. So even though you remove all the cyanobacteria cells from your drinking water system, you need to apply a different treatment or adjust your treatment to remove the toxins. That includes a cost to your treatment. In addition to that, they tend to produce taste and other problems. So you have to deal with the taste and other problems. You have to increase your disinfection or chlorine. And if you increase your disinfection, there is a risk of then producing disinfection byproducts. So that is another cost and another risk that you include in drinking water systems. Recreational activities, I don't know how many of you have heard, well, the beach is closed, the lake is closed because we have an algal bloom. So you have a cost or a loss of revenue, let's put it this way, because you cannot recreate at that beach. The industry fish and shellfish is also affected. Many closures, as you see or you saw at the diagram, fisheries and harvesting areas that cannot open or sell because the fish is contaminated with algal toxins. And it have resulted in millions of dollars. There is one report dated 2011, if I'm correct, that on shellfish and other fish on the marine side, they have estimated more than $11 million in losses at that time. We don't have comprehensive economic evaluation or assessment of the damage and consequences of harmful algal blooms in the U.S. We don't have it. We can estimate what is the cost, but we don't have that comprehensive economic analysis. So as you can see, and I hope I convince you, and you all know, this is a One Health approach. It's an interdisciplinary way of approaching health issues, recognizing that there is that connection between human health, animals, and environment. And HABS is a worldwide problem. It's not only here in the US, it's all over the world, and benefits and needed that One Health approach. So at EPA, let's see. Okay, so at EPA, we are taking different actions to address harmful algal blooms that follows that One Health approach. We do regulations, as you all know. We do guidance and technical support. We do research and develop new technologies. We do outreach, partnerships, and we do health assessment and ecological assessments. And this is an interdisciplinary approach that we use. We have microbiologists like me. We have ecologists. We have toxicologists. Everything that ends in gist, but not gynecologists. But we have epidemiologists, chemists, hydrologists, biologists, taxonomists, economists. We also have oceanographers, modelers and statisticians, engineers, public health specialists, and we have veterinarians as well. Next. Okay, so now I'm going to go over those different activities. Regarding regulations, under the Safe Drinking Water Act and the Clean Water Act, which are the two regulations that we use for our water system in the US, we don't have a regulation for cyanotoxins under those two. However, in 2015, President Obama amended the Safe Drinking Water Act, with SDWA, by adding that new section, it's called the Drinking Water Protection Act, to ask EPA to develop and submit a strategic plan on how are we gonna address the issue of harmful algal blooms in drinking water systems. And so they asked us, you need to do this in 3 months. So by November 2015, we published the Algal Toxin Risk Assessment and Management Strategic Plan for Drinking Water. In that plan, we included an assessment of what are the toxins that we have found in drinking water systems. What is the research that we are doing regarding toxins in drinking water? what are the research that is needed in order to address the research questions, and what are we planning to do. So it's all there. And by the way, if you are getting a PDF of this PowerPoint, all those are links that you can go and get more information. So we we submitted that to Congress in November 2015. Okay, so under the Safe Drinking Water Act, we use maximum contaminant levels, which is the regulations for contaminants in drinking water systems. In order to develop a maximum contaminant level, we use the contaminant candidate list, or the CCL program. That program lists those contaminants for which we don't regulate, but could be in drinking water system, could have a potential effect, and they are probably needed for regulation. So what we do is we create this list that we publish every 5 years of those unregulated contaminants. We evaluate all the health effects from exposure to drinking water. We evaluate occurrence in drinking water system, and then we make a regulatory determination. We determine, okay, if we regulate for this contaminant, we're gonna protect public health. If we don't regulate, it's because it's not needed, or we can't regulate at this moment because we don't have the information. In addition to that, we also do an economic analysis of the impact of regulating that contaminant in public water systems in the US. So the first CCL list was published in 1998, and we included cyanobacteria and cyanotoxins. And since then, every 5 years, we've been publishing. The last one was the CCL4, 2016. Cyanobacteria and cyanotoxins were also included there, microcystin, anatoxin, saxitoxin, malolactin, cylindrospermopsin, etc. So in support of the CCL, we do health assessments, right? I mentioned health assessments and occurrence information. Next slide. That is the guidelines and technical support we provided. So that's the 2015 Drinking Water Health Advisors for microcystin and cylindrospermopsin. So what we did was we did 3 health assessments, one for microcystin, another for cylindrospermopsin, and another for anatoxin A. We evaluated all epi data, toxicity data, animal data in one document, and we determined what is going to be the risk if you're exposed to this toxin in drinking water. For anatoxin A, unfortunately, we don't have enough data. Therefore, we couldn't publish or develop a drinking water health advisory, but we do have an environmental assessment or a health assessment that will be edited or revised once information becomes available. But we did have information to develop a health advisory for cylindrospermopsin and microcystin. Health advisories are non-regulatory. That's very important. They're non-regulatory guideline values that states and public health and public water systems can use to protect public health from cyanotoxins in drinking water systems. And that is a concentration at which you will not have an adverse effect during a specific exposure of time. So we develop health advisories for short-term exposures, 1 day and 10 days, or long-term exposures like chronic effects. Regarding cyanotoxins, we develop a 10-day health advisory because we tend to be exposed just during a bloom season or a short period of time. And we develop 2 values for each toxin, just to make it easier. We develop a bottle-fed infants and preschool children, 1 value, and 1 value for preschool children and adults. And the reason is because we evaluated the intake rates. We know that children tend to ingest, because of body weight difference, more water than adults. Infants, that's all they drink, either breast milk or formula. Formula is water, so their ingestion is 100%. They are the population that are at high risk if you have drinking water that is contaminated with cyanotoxins. When we saw the rates of drinking water, we saw that by the age of 6, as a baby grows, you tend to include more food in your diet, so you start drinking less water and less fluid. And by the age of 6, and all the way to adulthood, the rates are the same as adults. So that's why we cut it right there, and we developed 2 values for the protection depending on the rate of ingestion. So we have 0.3 micrograms per liter and 0.7 for microcystin and cylindrospermopsin for bottle-fed infants and preschool children, and 1.6 and 3 for 6 years old or school-age children and adults. That's for drinking water. We have a problem in recreational waters as well. So we develop a draft ambient water quality criteria or swimming advisories under the Clean Water Act for the protection during recreational activities in surface water and the exposure to microsystems and cylindrospermopsin again. So we developed a draft. It's 4 micrograms per liter for microcystin and 8 for cylindrospermopsin. It was published on December 2016. Since then, we have received new information on ingestion rates, and we have comments from the states. And so now we are evaluating these draft values, and we're finalizing the document to come with values for the protection of recreational activities. Within that, and in support of the health advisories and recreational draft guideline values, we also provided technical support. So we developed analytical methods, both for drinking water and surface water. And if we go back to CCL, we needed health effects and we needed occurrence information. So now that we have analytical methods, we can go and test drinking water systems and determine if we have cyanotoxins in drinking water in the US. We also developed with the health advisory recommendation document, just in case the drinking water systems, again, this is not regulatory. If they want to deal with the problems of cyanotoxins in the drinking water systems, they can use that document, and it's a step-by-step document. We develop management plan templates for drinking water systems to develop management plans. We develop cyanotoxins risk communication toolbox, and it has different blurs that they could use in case they have a do not drink, or in case they have a bloom that they could use for press releases. They can use it for Facebook and signage that they could just adapt to the value that they use. And also we develop a web page. So for the recreational side, we did the same thing. We developed a communication toolbox with the same messages. We developed a monitoring, and we developed a monitoring document, and we also developed a web page. So there are other technical support documents in support of the health advisories and criteria document. We also do assessments, and as I mentioned with CCL, we need occurrence information. So we use the unregulated contaminant monitoring rule. So we included cyanotoxins in the UCMR4, which requests drinking water systems in the US to do monitoring for these toxins for the next 3 years. So by 2020, we will have information of toxins in drinking water, finished drinking water in the US that we could use with the health information that we have and make a regulatory determination if needed for cyanotoxins in drinking water. In surface water, we use NARS. NARS is a National Aquatic Resource Surveys. We have 4 different types of surveys. These surveys are published every 5 years, and it's about, gives you a snapshot of the water quality in the US. We have a survey for lakes. We have one for wetlands. We have coastal survey, and we have rivers and streams. And so it's not only for cyanotoxins, they also measure nutrients, they also measure metals, chemicals, etc. So cyanotoxins was first included in the 2007 National Lakes Assessment. They found that 1/3 of the lakes that were sampled contained microcystin in their waters. Only 1% were above the risk value that they used. It was the World Health Organization value. And they also have included other toxins in the other surveys. But we don't have that data yet, but we are looking for that data in the different surveys. So we're going to have a snapshot of the water systems and drinking water treatment plants and the presence of cyanotoxins in them very soon. This is a non-EPA activity HABS assessment, but I needed to include it because it's the first national system that was developed in 2016 by the Centers for Disease Control to report HABS-associated illnesses in animals and humans. So we started working on this. EPA and other federal agencies and many states worked together with the CDC to develop this system in 2014, and it was launched in 2016. It's a voluntary web-based system for states and territories to provide information on HABS-related illnesses on animals and humans, and also to include environmental data. It's connected with NORS, which is different from NARS, the National Outbreak Reporting System. As you can see, they have a different criteria for outbreak. In NORS, they use more than 2 cases as an outbreak. On HABS or OHABS, which is One Health, they use a single case as an outbreak just because people didn't report it doesn't mean that the bloom existed. So 1 case, and that's a courtesy slide from Lorraine Becker from the CDC. We also do a lot of outreach. As she mentioned, the EPA Cyanobacteria HABS webpage was launched in 2012. It includes all the information that I have just shared with you and a little bit more. And there's one tab that is on the states. So if you want to know what your state is doing, if your state have the HABS program or if they have any HABS advisory or closing, you can click there and see what your state is doing. And also, it's also for the states to find laboratories in case they have a HABS bloom and they don't know who can test and how to determine. They can look there for laboratories. There's a freshwater HABS newsletter. It started in 2014. It's a monthly newsletter with news, events, health advisories, new publications, and conferences, and new events and webinars, etc. 2 fact sheets that we have published. One was in 2012 and then updated in 2014 after the Toledo event. It's a Cyanotoxins, cyanobacterial cyanotoxins for drinking water operators to deal. Thank God we have that fact sheet during the Toledo event. We also in 2013 developed a fact sheet on climate change and harmful algal blooms. And now we're working on a fact sheet on fish and cyanotoxins. We do a lot of webinars and we collaborate with CDC and USGS to do webinars every 3 months. And we have several videos on HABS. We have a video on the protection of dogs, water harmful algal blooms, and there's another video in that YouTube page that is on analytical methods, in case you want to know what are the analytical methods available. There's a EPA HABS listserv. If you have any questions or concerns, you can send an email to that email address. We do a lot of partnerships as well. We are part or an ex-officio member of the National HABS Committee with the CDC and USGS. With NOAA, NASA, and USGS, we lead the project on Cyanobacteria Assessment Network. This is using remote sensing or satellite data to monitor for algal blooms and cyanobacteria blooms in freshwater systems. NOAA has been doing that for a while in coastal waters, but now we're doing it in freshwater systems, and that will help states and others in their monitoring efforts. It will not replace, but it will help them in monitoring efforts because it could tell you how the bloom is spreading and it's moving. We do EPA regional workshops on HABS. EPA divide the US in 10 regions. We started in 2015 doing these regional workshops. This year, next month, is our Region 4, which is Atlanta, Florida, and the southeast side is our 9 regional workshops. We're almost there. It's usually 2 to 3 days, depending on where we are. We have to include a marine side, so it's 3 days. If it is in the inside, it's just freshwater systems. It's on drinking water and surface water. We bring experts. We bring the states, drinking water operators. We all together, people working on Clean Water Act, with people working on Safe Drinking Water Act, together to talk about the issues that lead to harmful algal blooms. Who are the experts in your zone, in your area, and what to do and how to address them. And we are the co-chairs of the Interagency Working Group for HABARCA. HABARCA is the Harmful Algal Bloom Hypoxia Research and Control Amendments Act. It was drafted in 1998, then it was amended in 2004. So HABARCA asked NOAA to develop assessments on what is the state's, what is the status of harmful algal blooms in coastal systems and Great Lakes in the United States. That was 2004. So they asked NOAA, you need to let us know what is the status, what is the research that needs to be done, who is doing what, and how can we address the issues. So several programs were developed, including one on emergency response in case of there's a shellfish or poisoning, etc. And then in 2014, it was amended to include EPA and say EPA with NOAA is going to work on harmful algal blooms in coastal waters and in freshwater systems. So that's why we co-chair with NOAA on the Interagency Working Group. And since then, they also asked us, okay, so tell us now what is the status of harmful algal blooms in the US, both in the freshwater and in marine side, and what is the research that needs to be done. So since 2014, we have published several reports. The first one was a strategic plan and research, the strategic plan and research. And then we did an assessment in the Great Lakes. We did a hypoxia in the Mexico, Gulf of Mexico. And just last month, we published the progress report and implementation plan of the strategic plan. So we're very active and this, I'm sorry, if we go back to that, these are some of the agencies that are part of the interagency working group. So we have NOAA, EPA, USGS, CDC, FDA, NIH, USDA, Army Corps of Engineers, NASA. So everybody that is related to the problem of harmful algal blooms, again, One Health approach is part of this interagency working group. Thank you. Lastly, we also do research. Research is very important for EPA. The Safe and Sustainable Water Resources Strategic Research Action Plan lists all the research that we're working on regarding HABs and nutrients. So those two things are together. So we divide our research program in 4 different areas. We have water quality, and so we have ecologists, we have modelers, we have taxonomists working on what are the different dynamics in the water, how the nutrients are making these blooms happen. And what are the other effects in the ecology. We have human and ecological health effects. We have microbiologists, toxicologists, veterinarians, epidemiologists working on what are the health effects from harmful algal blooms. We have monitoring and analytical methods. We have chemists, and we have modelers as well that are either developing the different methods that I mentioned before, or they're just developing qPCR techniques or fluorimeters or many other different techniques that are needed for the detection of these toxins. And the drinking water treatment, we have a lot of good engineers that are working on how to optimize your drinking water system to remove toxins and what needs to be done to get the toxins out of the water. And for me to just even mention one project or, for each category is going to take another hour, so we're going to leave that for another presentation. Lastly, prevention is very important. Prevention should be the first thing in public health. And we always talk about prevention at the end. We usually tend to be very reactive instead of being proactive. But we try to talk a lot about source water protection. As I mentioned, nutrients is a big issue regarding harmful algal blooms. So protecting your water source, your watershed is very important, not only for big companies and farms, but only for you as a community member. Avoiding using the excessive fertilizers. Just because you add more, you're not going to have a lot of tulips. Using barriers to prevent the runoff of nutrients into water in like agricultural areas. Monitoring and detection is very important, not only for water quality but also for health. If you are a person who's working in the community or in the Department of Health, you need to know what are the effects so you can relate, okay, this may be related to a harmful algal blooms. It's not something she ate at a Mexico place, or at Chipotle. It could be related to another exposure that person had. And it needs to be done proactively. If you know that you have a lake with a historical occurrence of harmful algal blooms, you need to start doing the sampling early. So some states, they just started last week, California, others start in May, just sampling every week for harmful algal blooms. And outreach and communication is very important as well. Not only to the public, all the people doing the sampling, but also to physicians, veterinarians, poisons control, and public, students. These are 2 examples of the CDC outreach materials. They did a physician reference for doctors, and they did one for veterinarians as well. On the top, there are some signs that have been used by states. As I mentioned, we have a communication toolkit that the states can also use as well. Prevention is very important, and the public health response is essential as well. And I think that's it. This is my contact information. The CyanoHABs website link, and thank you for listening. And I could address any questions now.
Thank you so much, Dr. Danglado, for your time. We'll do questions in a second. Since our inception at the One Health Academy, we always present our speakers with a flag that's been flown over the Capitol. So thank you so much for joining us.
Thank you.
And for your wonderful presentation. We don't have a lot of time, guys, so I'll take a few questions, maybe one or two, and then encouraging everyone to utilize the locations nearby to further network. So I will pass this off. Oh, and last but not least, I need to make a plug for the One Health Commission. Thank you so much for their providing the webinar. And we have links on our website to help support them and donate if possible. But we are really appreciative to those that aren't able to be here today to have access to this information. So thank you to the One Health Commission. And any fast questions for Dr. Danglado, please? Yes, I will pass around this microphone.
Okay.
Go ahead.
Great talk, congratulations. So my question is, given the time that you work with the algal bloom, what is the average time that they actually last? That's something that I'm very interested in. How long do they last? And actually, my background is in microphysiology, so this is very interesting. My question is, so a lot of the targets to prevent these algal blooms actually pre-attack, but any plans of the EPA of how to directly attack the micro when the algal blooms happen? So you know how you're trying to prevent to have the salts and everything like that, and of course there's this like closing the water valve, but what can you do to actually directly target the micro when it's out happening? So
Very good question. So the one is on duration of the toxin, I'm assuming. Okay, so it all depends on the toxin. For example, microcystin can be there for weeks in the water body, anatoxin, hours. So you could have a bloom with anatoxin, your dog is dead. I mean, your dog is there, then he's dead. And then you have someone sampling and there's nothing. But when they do that autopsy, which is not always done, then they found the toxin. So it all depends on the toxins. They could last, single spermopsin microcystin, it can tend all the way to weeks, 11 days, or a little bit more, and anatoxin very little. So the second question was how to attack the microorganism itself. I got that right. So you have the bloom. You don't know you have a bloom until you see the change in color. That's the first thing, right? And you can have a bloom without the toxin. So what people usually use is algicides. So they use copper, they use salt. The problem is the algicide will break the toxin, will break the bloom, I'm sorry. So that's good. But if the toxin was inside the cell, then you have a worse problem because you used to have a bloom, now you have a toxic water right there that you have to wait for the toxin to go. So that's.
We'll take one more question, guys.
So in the Chesapeake Bay, I've noticed that there's low oxygen, all through the bay, even when you don't see necessarily blooms. Is that a different mechanism, or what's the source of low oxygen in the bay?
That's a very good question. Low oxygen or hypoxia is also the other term. They are related, but not necessarily one is depending on the other. So harmful algal blooms can cause hypoxia because, again, the overgrowth will take all the oxygen. Then the breaking of the cyanobacteria bloom will release or will reduce the oxygen in the water. Hypoxia can be caused just by the degradation of any material in the water. That's why we have the big hypoxia zone in the Gulf of Mexico, but we don't see as many blooms all the time. So they are not related, but HABs can exacerbate the problem of hypoxia.
Okay. We will encourage questions after we sign off, but yes, please ask Dr. Danglado any other questions you have after we close here. But thank you so much for everyone who's come and participating with us. I want to leave a last plug to please sign in with Sarah in the back if you haven't already, and pay if you haven't already. But please look out for our webinar on the 25th. That's a webinar only on our website. And thank you so much for meeting us at this new location. Thank you to Sean, ASM again, so much for hosting us. And we look forward to seeing you guys soon next month. Thanks so much, guys, for coming.
Thank you. Thank you. know you're gonna have questions further. Thank you so much.
No, yeah,
Oh no, it was thorough. It was wonderful. I'm gonna turn off the webinar real fast.
did that answer your question?
It did. Do you happen to know